Hello class, my name is Cynthia Payanis and I chose anxiety disorder as my topic for this project. I chose it because it kind of hits close to home. I myself suffer from anxiety. About 4 years ago, I got a divorce and I started having anxiety attacks so bad where I couldn't drive and I just had like this tunnel vision and I just had this feeling of doom. So I went to go see a doctor and he prescribed medication to treat depression. So that in turn helped the anxiety. And I recently got off the medication about a year ago. So I definitely am coping with anxiety a lot better. Breathing helps. So that's why I chose this topic, just because I felt like I could definitely relate to it on a personal level. So I wanted to talk about like the symptoms, diagnosis, role of nature and nurture. And I think in my situation, it was more of my surroundings, the nature that affected the why I got the anxiety and so forth. So, and then I also want to talk about like treatment, like successful treatments, and my views of psychology and how this course has affected my life and how I think I'm going to use this course in my future, for my personal life, and not only that, but in a professional setting as well. So first, there's different types of anxiety disorders, which I didn't even know myself. So there's generalized anxiety disorders, obsessive compulsive disorders, panic disorders, post-traumatic stress disorder, social anxiety disorder, and specific types of phobias. So when it comes to the symptoms, everybody experiences symptoms differently if they have anxiety. Everyone's like has their case is very it's very special just to themselves. And I think that's with any type of mental disorder. It's very personalized. It's very complicated. Not everybody's going to have the exact same symptoms and causes, and even treatment would be different depending on, how you're going to react to certain treatments and what works for you. So some of the symptoms that I found were difficult sleeping, dizziness, dry mouth, feeling of nervousness, panic, fear, and feeling uneasy, muscle tightness, nausea, rapid or irregular heartbeat, sweaty and cold hands or feet, tingling or numbness in the hands, unable to keep calm and hold still, sense of doom, and trouble concentrating. And a lot of these symptoms, I can personally relate to. I found that has happened to me in the past. So anxiety disorders are it's very common in the U.S. I found on ADAA.org, which is Anxiety and Depression Association of America, 40 million adults ages 18 and over experience some type of anxiety disorder. So that's about 18.1% yearly. It's highly treatable, but out of everyone that's experiencing some type of anxiety disorder, only 36.9% of these will seek some type of treatment. And I know, because it can be you have to swallow your pride. If you're going to, like, I know for myself, I had to swallow my pride, go to the doctor and admit that I'm having these feelings and having these type of symptoms. And it can be very embarrassing, but once you do it, you're glad you did. You feel that sense of relief, like a weight is off of your shoulder. So I wish that it was more, that rate was higher of people seeking treatment. So I found that we have this flight or fight sense within us. Everybody does. And the reaction activates the physical and psychological resources necessary to deal with like potential dangers. And it works well if we're in a dangerous situation, if we're being mugged or our child, something fell on our child and we have to lift that up. Like, that's going to help us in those situations. But our bodies tend to just overreact, and we have this anxiety when there's no emergency in place that we need to be feeling those type of feelings. So no one knows exactly what causes anxiety disorders. there seems to be a variety of factors: genetics, environment, going through something very stressful, like for instance a divorce, changes, trauma. But I feel like we're still learning so much about anxiety and even other mental disorders. I feel like we're still learning so much, and to even know the history of it and what doctors did in the past to treat anxiety and other types of disorders, it's very interesting. But I think some of the ways were kind of like barbaric, but then again, I felt like that process almost had to take place in order for us to get where we are today in knowing about mental disorders. So I also found that women experience more anxiety than men. So it is recommended by doctors over the age of 13 should be screened for anxiety, in their routine exam visits. So some of the diagnosis can be done by a doctor, psychiatrist, a psychologist, a counselor. You can use they use specific diagnostic tools like a questionnaire. I know as for myself, I had to answer a questionnaire, and that's how I was diagnosed with it. Some of the treatments include medication, psychotherapy, and coping strategies, and just calming yourself, breathing techniques, and just accepting it for what it is like, I think, like a first step in anything. So I think psychology is very interesting. It's definitely sparked an interest in me just going through this whole course, and I think it will benefit anybody, like on a professional level, because you work with people, different types of personalities, different type of characters every day, and it is beneficial if you know how to interact with them, why they do what they do, what motivates them, even as a supervisor, what motivates somebody, because what motivates some person to work is not going to be the same as another person, and that's all mental, that's all psychological. So I think it's very beneficial to know this and know how people work and how people interact, and the best way that you can interact with them to be the best possible leader that you can be. I think is very important. So I'm definitely going to continue to study some type of psychological studies after this course, even after this course is over. So definitely I'm going to incorporate it into my life, into my personal life. It's already been incorporated into my personal life. I definitely believe in the studies and the treatments and the medications if it's properly monitored. So the information that I got was from livewellfoundation.org and also adaa.org. And thank you all for listening to my presentation.